Hi, this is Dr. Tayani from the Tayani Institute, ophthalmologist and oculoplastic surgeon. I'm here today to talk about a procedure called the Hughes Graft, or the tarsal conjunctival graft. This is a specific procedure that we do for either defects or cancers of the lower lid that are larger than half the size of the lower lid, and we cannot do what we call a primary closure. So let's say if this is the eyelid and we have a tumor here, we're cutting this out, we can bring it back together. That's called primary closure. If that's not possible because the defect is just too large, the next step is to do what we call a Hughes graft. And that's a very kind of a cool process. We use the inside of the upper lid, we turn it into like a tongue and groove into the lower lid. That creates the back wall of the lower lid. And then we take skin from either the opposite upper lid, behind the ear, or from the clavicle, and use for the graft on the front of the eyelid. So it's a double graft. Anytime you do graft tissue, you need blood supply for it to take. And if we're doing a double graft where the front is skin graft, the back is another graft, if you don't have the blood supply, that will fail. So in order for it to succeed, we use a pedicle graft, or in other words, a tarsal conjunctival graft. Use that upper lid, leave it intact, leave the blood supply there. That will feed the back end of the eyelid, and it provides blood supply for the front skin of the eyelid as well. And this will remain in place for 1 month. The bad news is the eyelid is closed shut for a whole month like this while that blood supply is working and healing the graft. Once that takes place, it's a 5-10 minute procedure to open the eyelid, and the beauty is that the eyelid is going to look fairly normal. The only thing is we're not going to have eyelashes in that area. However, as you all know, the lower lid has very small eyelashes to begin with, and it's hardly noticeable when this procedure has to be done that there is no lashes. So a great procedure to help reconstruct an entire lower lid or anything larger than half of the lower lid defect from trauma or cancer that requires the reconstruction. The eye does remain closed for 1 week with a patch, and after the patch is removed, it remains still closed for another month, and then the eyelid is opened with a second procedure. This is Dr. Tayani from the Tayani Institute. Till next time.